He thought it was just stress. Jason, 52, was a hard-working father of 3. He didn't drink, didn't smoke, but for months he'd felt this dull pressure under his ribs. His feet would swell at night, and his skin. It was dry, itchy, and breaking out in weird red spots. Doctors kept saying it was nothing serious, but one day he collapsed. The diagnosis? Advanced liver disease. The most terrifying part? The signs were there all along, but they were so weird, so easy to ignore, that no one thought to connect the dots. You see, your liver doesn't cry for help. It doesn't throb or ache like a broken bone. It speaks in whispers, through your skin, your eyes, your nails, even your mood. And over 1 in 4 American adults are living with undetected liver problems right now. It's not just about alcohol. Your diet, medications, even your stress levels could be pushing your liver closer to failure without you realizing it. Today, I'm going to walk you through 9 unusual signs that your liver may be struggling. And trust me, these aren't the ones you'll hear about at your yearly checkup. Watch closely. Your liver might already be trying to warn you. Liver disease doesn't happen overnight. It creeps in slowly, often silently, until one day it changes everything. The liver is your body's detox powerhouse. It filters your blood, removes toxins, regulates nutrients, and plays a role in over 500 vital functions. But here's the catch. It can take years for liver damage to show up in routine tests, and by the time symptoms are obvious, the damage may already be severe. Even if you don't drink alcohol, your liver is constantly under attack. From hidden sugars in your food, over-the-counter medications, processed vegetable oils, chronic inflammation, and even common viral infections. But the liver is also a miracle organ. If caught early, it can heal itself. That's why recognizing these subtle, weird warning signs could be the key to reversing damage before it's too late. Let's dive into the first strange symptom your body may be showing if your liver is in distress. Sign 1. Pale, floating stool. Let's start in a place most of us don't like to talk about, the bathroom. It might sound strange, but one of the earliest and most overlooked signs of liver trouble shows up in your stool. Specifically, when it turns pale, clay-colored, or begins to float. Here's why it matters. Your liver produces bile, a greenish fluid that helps break down fats and gives stool its typical brown color. But when your liver is damaged, bile production slows down or gets blocked. This disruption means your body can't digest fats properly, and the color of your stool fades. The result? Light-colored, sometimes floating stools that may even stick to the sides of the toilet. Some people ignore it, thinking it's just a weird meal they had. But if this keeps happening, especially alongside bloating or oily residue in the water, it could mean your liver isn't processing fats like it should. Think of your digestive system as a mirror of your liver's health. If your stool looks off for more than a few days, don't ignore it. It might be the first subtle whisper from your liver that something's wrong. Sign 2. Night blindness, nyctalopia. Have you recently struggled to see clearly when driving at night? Or maybe your eyes take longer than usual to adjust in the dark. This isn't just about age. It could be a hidden sign of liver dysfunction. Night blindness, also known as nyctalopia, occurs when your eyes have difficulty adapting to low light. What most people don't realize is that this issue can be linked to your liver's inability to process and transport vitamin A, a key nutrient for healthy vision. Here's the science. Your liver produces a special protein called retinol binding, protein, which delivers vitamin A from your liver to your eyes. But when your liver is damaged, production of that protein slows down. The result? Your retinas don't get the vitamin A they need, and your night vision begins to suffer. It's subtle at first. You might just squint more at night or need brighter lights indoors. But this is more than just an eye problem. It's your liver crying out for help. If your night vision has recently changed, and there's no obvious cause like aging or eye strain, don't dismiss it. It could be one of the earliest red flags that your liver isn't functioning the way it should. Sign 3. Swollen right foot or ankles. Have you ever looked down and noticed your right foot or ankle mysteriously swollen, especially at the end of the day? This might seem like a circulation issue or maybe even a reaction to salty food, but it could actually be your liver sending a distress signal. When the liver is damaged, it often stops producing enough albumin, a vital protein that helps keep fluid inside your blood vessels. Without sufficient albumin, fluid leaks into surrounding tissues, especially in the lower parts of your body thanks to gravity. But here's what's really interesting. For many people with early liver dysfunction, the swelling starts, or is, more prominent on the right side because that's where your liver sits, and that's where blood flow begins to back up first. This condition is called peripheral edema, and while it can have other causes, when paired with other signs, like fatigue, poor digestion, or changes in urine, it strongly points toward a struggling liver. If you notice persistent swelling in your feet, especially on one side, don't brush it off as just getting older. Your body could be warning you of something deeper, and earlier detection means a better chance at healing. Sign 4. Yellow or white bumps around eyelids. Have you ever spotted small yellow or white bumps forming around your eyelids? They might seem harmless, just little cosmetic annoyances, but they could be telling a much deeper story about your liver. These bumps are called xanthelasma, fatty deposits of cholesterol that build up under the skin, often around the eyes. And while they don't hurt, they're often a red flag for liver dysfunction, especially when the liver can no longer properly process fats. Here's what happens. When your liver is compromised, its ability to break down and eliminate cholesterol becomes sluggish. That excess cholesterol doesn't just stay in your bloodstream, it starts getting stored in odd places. The eyelids are one of the first spots where these deposits show up. People usually treat them with creams or cosmetic procedures. But without addressing the root cause, which could be a fatty or inflamed liver, they tend to come back. So if you've noticed these small white or yellow patches near your eyes, don't just see a dermatologist. It might be time to check in with your liver too. It could be warning you right on your face. Sign 5. Right-sided rib pressure or shoulder discomfort. Have you ever felt a strange pressure just under your right rib cage, especially after eating, or maybe a nagging tightness in your right shoulder that just won't go away? This isn't just gas. And it's not always a pulled muscle. It could be your liver struggling to keep up. Your liver sits on the right side of your body, just beneath your rib cage. When it becomes inflamed or when thick, sludgy bile builds up due to liver dysfunction, it can put pressure on nearby organs and nerves. In particular, it can irritate the phrenic nerve, which connects to your diaphragm and shoulder. The result? A dull ache, fullness, or even pain in your right side or shoulder area, especially after meals when your liver is trying hardest to digest fats. Most people never associate shoulder tension or side discomfort with liver issues. They might stretch, take a painkiller, or ignore it completely. But this subtle pressure could be a key early indicator of liver congestion or gallbladder backup. And the sooner you listen, the better chance you have to reverse the damage before it becomes permanent. Sign 6. Cracked heels. Cracked heels might seem like just a cosmetic problem, or a sign you need better moisturizer, but in some cases, they're actually your liver waving a red flag. Here's how it works. Your body relies on vitamin B3, also known as niacin, to keep your skin soft, hydrated, and resilient. But when your liver is damaged, it begins to burn through its stored nutrients, especially niacin, in a desperate attempt to repair itself. That means your skin, especially tough, areas like your heels, starts to dry out, harden, and crack. No matter how many lotions or foot scrubs you use, the problem keeps coming back. Because the real issue isn't on the outside, it's happening deep within your liver. You might also notice that the skin on your feet looks flaky, sore, or even slightly yellow, another potential liver-related symptom. If cracked heels have become a regular part of your life, especially if they appear alongside fatigue, poor digestion, or skin changes elsewhere, don't just treat it with creams. It may be time to take a closer look at your liver. Sign 7. Swollen, white, or clubbed nails. Take a moment and look at your nails. Are they pale or almost completely white? Are the tips of your fingers swollen or rounded, almost like drumsticks? These subtle changes could be revealing more than you think. Your nails are a direct reflection of what's happening inside your body, especially your liver. White nails, also known as Terry's nails, are often seen in people with advanced liver scarring or cirrhosis. When the liver stops functioning properly, it affects blood flow and oxygen delivery to the nail beds, draining them of their normal pinkish color. Even more telling is nail clubbing, where the tips of your fingers appear bulbous or rounded. This is often linked to chronic hypoxia, low oxygen in the blood, which can happen when liver disease progresses. These changes don't appear overnight. They develop slowly, often without pain or obvious warning signs. So if your nails have changed in shape, color, or thickness, and you've noticed other symptoms like fatigue, swelling, or skin issues, it might be more than just a cosmetic concern. Your nails could be quietly revealing liver damage before any lab test does. Sign 8. Purple or red skin bumps, easy bruising. Have you started noticing purple or red spots on your arms or legs, almost like little bruises or rashes that seem to come out of nowhere? This could be a signal that your liver is no longer doing one of its most essential jobs, producing the proteins that help your blood clot. When the liver is damaged, levels of fibrinogen and other clotting factors begin to drop. This makes your blood more prone to leaking under the skin, even from minor bumps or pressure. The result? Strange red or purple petechiae, unexplained bruises, or raised spots that may resemble a rash. You'll often see these on the lower legs, arms, or even around the stomach area. Some people mistake them for allergic reactions or aging skin, but in reality, they can be signs of liver-related blood circulation issues. The liver plays a silent but powerful role in how your body maintains balance. If it's struggling, your skin may be one of the first places to show it, so don't dismiss these odd marks. They might be the surface-level signs of something happening much deeper. Sign 9. Dark urine. Let's talk about something most people glance at but rarely think twice about: your urine. If you've noticed that it's darker than usual, especially a deep yellow, amber, or even brown color, it could be more than dehydration. It might be a warning that your liver is in distress. Your liver is responsible for filtering out bilirubin, a yellow pigment created when red blood cells break down. Under normal conditions, your liver processes it and sends it out through bile and urine. But when the liver is damaged, bilirubin starts to build up in your blood, and your kidneys try to take over. That's when your urine darkens significantly. This can be one of the earliest signs of hepatitis, fatty liver, cirrhosis, or even liver cancer. And unlike temporary changes caused by certain foods or medications, liver-related urine discoloration tends to persist and may be accompanied by yellowing skin or fatigue. So, if your urine suddenly takes on a dark tea-like color, and it isn't from something you ate, it's time to listen to your body, because when the liver speaks, even through the smallest changes, it's begging you not to wait. What to do if you notice these signs? If you've experienced any of the signs we just covered, don't panic, but don't ignore them either. The truth is, liver damage is reversible in many cases, especially when caught early. Unlike other organs, the liver has a remarkable ability to regenerate and heal itself, but you have to give it the right environment to do so. Start with your diet. Eliminate inflammatory seed oils like canola, soy, and corn oil. Replace them with healthier fats like olive oil, butter, and coconut oil. Cut back on processed foods, added sugars, and especially fructose, which can be just as toxic to the liver as alcohol. Drink more water, at least 1 liter per day, to help your liver flush toxins. Add turmeric to your morning coffee for its powerful anti-inflammatory effects, and consider liver-supporting herbs like milk thistle, dandelion root, and ginger. Another powerful step? Intermittent fasting. Giving your body longer breaks between meals allows your liver to clear out fat and toxins more effectively. Finally, talk to a healthcare professional. Simple blood tests and an ultrasound can detect fatty liver early, giving you a chance to reverse it before it becomes irreversible. Your liver is trying to heal. Give it the chance it deserves. Your liver doesn't cry out in pain. It whispers through your skin, your eyes, your digestion, your energy, even your emotions. So many people walk around every day ignoring these whispers until it's too late. But not you. Not anymore. If even one of these signs felt familiar, take it as your body's nudge to pay attention. Because healing doesn't start at the hospital. It starts at awareness. It starts at home. Take action now. Clean up your diet, support your liver, and most importantly, share this video with someone you love. You could be the reason they catch the warning signs early and avoid a lifetime of pain. And if you found this helpful, don't forget to like, subscribe, and comment below. Have you ever noticed any of these signs? What changes are you making? Today, for your liver, let's build a healthier future together, starting with one organ that never stops fighting for you: your liver.